Senate Bill 331. Imagine this. Imagine you take your child to an urgent care clinic for a simple visit. You can ask what it will cost, but they cannot tell you up front. Weeks later, a bill shows up that is far higher than you expected, and there was no way to compare prices beforehand. What the bill says it does? Senate Bill 331 says it will expand healthcare price transparency so more medical facilities have to post their prices online, not just hospitals. What it actually does? This means large healthcare facilities can continue operating without posting prices for several more years, while smaller clinics are exempt entirely. Patients still cannot see the prices in advance, and enforcement does not begin until 2029. Who benefits? Large hospital systems, insurance companies, business and policy groups that favor delayed market based reforms, healthcare facilities that already have legal and data teams to prepare for future compliance. Who pays the price? Patients who need care now and cannot shop for prices. Rural communities that rely on smaller clinics excluded by the revenue threshold. Families facing surprise medical bills with no advance warning. And taxpayers if enforcement costs rise later without meaningful patient benefit. Why it matters. Healthcare costs already feel unpredictable and unfair to most Texans. When prices are hidden, people cannot make informed choices, and the financial stress shows up later in household budgets, debt, and missed care. Delaying transparency protects powerful players while everyday Texans wait in the dark. Questions to ask your lawmakers. Why does this bill delay price transparency until 2029 when patients are struggling with surprise bills today? How are rural Texans protected when many local clinics are exempt from the disclosure rules? And would you support moving the deadline sooner so transparency actually helps families now? Bottom line, Senate Bill 331 promises transparency, but delays it long enough that patients keep paying blind while the system stays comfortable.